Hello, my name is Jonathan Maya, and I'm a third-year health science major on the pre-medical track. Today in this video, I will be discussing infectious diseases and how they might be controlled in both urban and rural communities, and what differences or similarities there might be in the approach that both settings utilize. I'm particularly interested in this topic as I'm currently pursuing a minor in public health, and I'm very interested in learning about these important topics. An infectious disease is one that originates from an organism such as a parasite, a virus, bacteria, or fungi, and can be easily communicable in a variety of methods. Public health officials are consistently trying to come up with ways to prevent the spread of these diseases when it comes to larger populations. Whether that be through investigating food sources, monitoring blood supplies, or other, public health scientists utilize the surveillance techniques to draw conclusions and perhaps find links between illnesses and then subsequent deaths that result from those illnesses. In addition, surveillance is crucial for assessing the effectiveness of regulatory and advisory measures designed to protect larger communities as a whole. Here, we'll be focusing on two types of communities: urban, technology-driven ones, and then rural ones, where resources might be more scarce. When it comes to healthcare, more urban communities typically have greater resources for delivering care for people, whether that be through more hospitals, cutting-edge technology, and the opportunity to utilize services from a variety of different medical specialties. Public health surveillance is, no doubt, more advanced than those found in rural communities. However, with such large populations, it can be difficult to track the spread of certain infections. So, for example, researchers have developed a new method in which sensors are placed in the network of large metropolitan hubs, which track new outbreaks and developments. This method, interestingly as well, suggests that outbreaks can be contained by a strategy of targeted vaccination combined with early detection, without resorting to mass vaccination. By utilizing this targeted vaccination, that also drives healthcare costs down, because that way you won't have to vaccinate more people. And so costs will stay relatively low, which is always a positive thing. In contrast to urban settings, rural communities typically have a tougher time when it comes to hospital availability, quality of care, and the amount of resources available to patients. Critical access hospitals, which are typically only found in these remote areas to begin with, are not typically regarded for the abilities for public health surveillance in managing the prevention and containment of large outbreaks. Access to medical literature and online sources appear to be very limited for these infection control programs, or ICPs. Most rural hospitals surveyed have expanded reasonable resources to develop infection control programs that have patterned those after the ones in the larger hospitals, and they conform to recommendations of a consensus expert panels. But even with all these new efforts to increase the amount of infection control programs, there's still much to be done in these areas. One method for tackling infectious diseases and monitoring their spread in rural areas in particular is through a new practice making use of GPS technology. A certain case study quantified the impact of both spatially and temporally unstructured routines on the transmission of an influenza-like pathogen. These routines were not dominated by a single location, such as a workplace, so it was a kind of place where individuals repeatedly spent a significant amount of time. Using this GPS technology, researchers were able to use something so simple, literally just migration and movement, to analyze patterns in disease transmission. Interestingly as well, this method was relatively cost-effective, which is not something you would expect from a technological advance such as this. Overall, however, this is a great step in the right direction when it comes to rural public health. There are a variety of reasons why disparities exist in the context of infectious diseases, especially between urban and rural communities. One of them being in the way in which communities can respond to natural disasters, which include hurricanes, fires, and even earthquakes. Often, outbreaks of infectious disease occur after natural disasters. Rural areas, also in general, are much less equipped to immediately deal with the medical aftermath of these events. Therefore, their efforts in containing the outbreaks are not going to be as expansive as those that would have been done in an urban environment. Secondly, socioeconomic status might be another factor in which you have these disparities in infectious disease control. Overall, people living in more rural areas tend to come from lower socioeconomic status and much lower income levels. Rural communities have fewer hospital beds, fewer physicians, nurses, and specialists per capita as compared to urban residents, as well as increased transportation barriers to access healthcare. With all these issues, infectious disease, as one study found, can spread at a higher rate than normal, because patients are not able to afford vaccinations and other prevention strategies that are crucial in controlling these outbreaks. We typically don't see these issues as often in large cities, where vaccinations are readily available and there are abundant of resources for protection. As an example, HIV/AIDS is a great concern in rural communities and is one of the most detrimental infectious diseases in modern-day medicine. Epidemiological evidence currently indicates that there has been a dramatic increase in the relative proportion of rural HIV/AIDS incidences over the past 5 years, stemming from either infection drug use or risky sexual behavior. In addition, rural areas are seeing an influx of already HIV-infected people migrating into certain areas, driving transmission and infection rates exponentially higher. The issue with this occurring in rural areas versus urban ones is that the rural areas have limited resources to educate people on prevention strategies and protection, therefore only adding to the risk of those areas even more. But looking forward, when it comes to infectious disease containment and prevention, it appears that rural communities have a long way to go to catch up to urban ones. First and foremost, I believe that there should be more educational programs available for people to learn about prevention strategies and how to protect themselves from the harm of infectious diseases. Also, I think it's important to remember that in whatever way public health evolves in the future, it's crucial that costs remain as low as they can and access to be as widespread as possible. If we dedicate ourselves to improving healthcare for rural areas and maintaining the strategies that are currently in place for urban ones, we could eventually see a narrowing of those disparities that exist between them. So I'd like to end with some discussion questions. Number one, what do you think might be one barrier to placing educational programs in rural communities when it is clear that they would help? And number two, in terms of socioeconomic status, inner city populations tend to be similar to rural ones. Do you think that inner city populations are more or less susceptible to infectious diseases than the rural populations? Hope you guys enjoyed this video, and I look forward to hearing what your comments are on these discussion questions. Thank you.